Hi, I'm Nina Clark-Christoph, one of the nurses at Cynthia Gregg Face and Body Specialist, welcoming you to our Patient Appreciation Day. My colleagues Megan Beria, Melissa Stocky are joining me today, and our buddy Andrea could not be here with us because she's expecting her new grandbaby sometime soon. And so the topic of this conversation is going to be about our philosophy of natural looking results and outcomes. And the number one reason people aren't interested in doing aesthetics procedures isn't the money, it isn't their fear of bruising or swelling. It's about having an unnatural looking outcome. And we see these Hollywood movie stars that have these really big, bizarre cheeks and these huge duck lips and these really long witch's chin. And that's certainly not what we're looking to accomplish with you. So we try to really look at having a natural look. And there's certain mathematical proportions that are considered ideal beauty. And so we're aware of what that should be based on your ethnicity and your age. One of the things that I think was overlooked until a couple years ago when Juvederm Voluma got FDA approved for the chin and Restylane Define got approved for the chin was ignoring that area. We would have these beautiful cheeks and lips, and then the chin can be recessed. It can go too far in. Having some chin projection can make that face look more balanced. As a rule, it should be 1/3 for the forehead area, 1/3 volume for the mid face, and then 1/3 volume from your nose down. And so having that balance, not only in projection on your profile view, but in the width of your face, it's that piece that I think we were missing,
Yes.
and
Yeah,
it just
agreed.
completes the whole picture. And a lot of people just aren't aware of what we can do with the chin. So I think it's a great thing. And Megan,
Yes.
why don't you share with us that other thing that people are afraid of, those
Yes.
duck lips?
The duck lips. A lot of people hear that term, and it's just overfilling in the lips. We have so many good products nowadays that you can use depending upon what your desired look is. Nina mentioned the ethnicity. The proportions can change based on the ethnicity, which we take into consideration when doing injections. You can get a little bit of Kiss, which is a type of hyaluronic acid that helps with the volume, or you could do density, and it gives more of like a lip gloss. So not really making them that much more full, but it helps to just plump them up a little bit. And not doing, Nina mentioned the chin, and that helps with the proportion as well. So you're not overdoing the lips, and then you have this back chin. So you're really making those proportions even, which I think is really good.
The other thing I forgot to mention was just we're also very thoughtful. We have a lot of male clients that come to us. And so our proportions of what a chin would look like on a female, where it would be more tapered. Men tend to have a wider chin, a stronger chin.
Yes.
And that would be true with cheeks or anything else that we do for our
Absolutely.
men that come in.
Kind of catering it towards the
And
male and females.
Agreed. And I think in general too, if we're just keeping that 1/3 around 2/3 ratio, depending on for the lips, depending on ethnicity, depending on the patient, when you find that real ducky or unnatural look, it's typically the ratio and it's overfilling of the top lip.
Right.
You'll see that often, and so we are very considerate about taking that into account based on your anatomy. But keeping with that appropriate little ratio of the lips has been what provides natural results.
Right. The lips, and then we also wanted to talk about the cheeks. So you can get what they call that pillow face,
Pillow face, yeah.
and we don't want to do that. We want to keep everything in proportion, and we try really hard to do that. The other thing I was going to mention was our neuromodulators. We have Botox, Dysport, and we have Xeomin. We also have Daxi, which is coming soon, hopefully by the end of the year, and we can start using that, approved for 6 to 9 months, so getting a little bit more longevity out of that. These neuromodulators, again, in the past, you've kind of seen how people can look overdone or have a little bit too much of the product and giving them that frozen look. Well, that's not what we want to achieve here. We want to make sure that you still have that natural look and that we can give you the wrinkle prevention, but still have some movement and making you look like yourself, an overall natural approach to how your face expresses itself, but then no wrinkles or really minimizing that look.
Agreed. And what they're finding also that, we're always up to date on the latest and the greatest, but if you completely immobilize and freeze, which we know this, what will happen is over time, you'll compensate, you'll start to recruit adjacent muscles, and then they'll start to build up. So the goal is just wrinkle prevention, softening of the lines. We're taking into account how you look now, but how you're going to look 5 years from now. So it's really important to provide assessment by us to determine, what's the best dosing based on your anatomy.
Right. It's always about balance.
Yes, absolutely.
Yes, absolutely.
And the other thing I think that we're missing a lot of time is temples. I know my clients, I love injecting temples. I think people can sometimes have these cheeks, and it's just like with the chin, if you're not in balance, if the cheeks, the temples are really hollow, again, it throws the proportions off. When we revolumize that area, it helps to lift that tail of the brow, and it's just a softening look. As we age, we can tend to become more skeletal, more masculinizing. So I think that's a nice area that can often be overlooked.
Agreed.
Melissa?
Yeah, and back to the pillow face term, that it's actually a medical term now. That's how overinjected the mid face is on patients. And typically it's not about quantity of filler, it's about placement. So you'll see a lot of lioness look placement, but we are always very, we customize the filler in the mid face or the cheek area to mimic what we're born with anatomically. We're not born with a giant plug of filler in the cheek area. This makes us look unnatural or cartoonish almost, right? We're born with it in different structures of the cheek, and it ages in a different way. And so we're very conscious about that. And so we won't give you that dreaded pillow face, but you'll see that often, even being a medical term, which is how often it's being injected. Now, the other thing I think we wanted to talk about is how at our practice, this practice, it's going to be a comprehensive approach. We're not just going to be the cookie cutter injectors that are going to focus on your face and, one and done. Every face is equal. We customize your treatment and also look at the whole body. We're going to take into account the neck, and we have a procedure for that called hyperdilute radius. We're going to collagen build the neck area. We also use soft wave now on the neck. So we're also going to take into account the chest. The chest ages as well. The hands, you can have a beautiful face and neck and chest, but the hands are sometimes a telltale sign of aging. So we've mastered kind of the ratio with radius to the hands, a 1-to-1 ratio, where you can have the nice softness to the hands, but also the collagen building of the radius. Also, there's other parts of the body that we can treat based on the patient with different modalities that we have. So we're taking into account the whole body. With toxins or neuromodulators, we're looking at like TMJ. Sometimes we inject for slimming up the jawline, or hyperhidrosis for sweating. So we're not just going to be cookie cutter. We're going to look at the whole body and kind of address things that are aesthetically concerning to the patient.
Right. And the hyperdilute radius that we do to the arms and to above the knee
beautiful,
areas
right.
is something that people have really enjoyed.
I agree. Yeah. Thank you so much for joining us today for our Patient Appreciation Day. And if you would like to ask any questions, you can email us. Our email addresses are below, as well as call the office and set up your consultation to determine what procedures you're a good candidate for.
Thank
so much.
you.
Appreciate it.